This is Dr. Brendan Cochran from Interactive Health Clinic. Hope you're having a fantastic day so far. A few proactive health tips, updates. A lot is going on right now as you're seeing the cluster boom continuing to take off. And one of our fears, of course, is overwhelming the hospital systems, because not only does that make it more difficult for patients to get care for the current episode of COVID, but it also makes it more difficult for patients like heart attacks, lung disease, diabetes complications, hypertension, those things that currently kill more people per year than what's going on currently with COVID. That prevents them from getting the emergency care that is often needed, and that creates a tremendous strain on the system. The other thing that's going on is, of course, testing, as you've noticed, is ridiculous right now. If you want to test and you want to run it through either free testing sites or insurance, you could be waiting up to 2 weeks to get a result right now. That's just because of the massive amounts of test kits that are hitting the labs, and it's creating a massive backup as well. Currently, we're still able to get test kits turnaround time in 2 to 4 days. However, again, it is using companies that do not commonly bill insurance. Remember, guys, I've talked about this in the past. Your insurance is unfortunately not always in your benefit for protecting your health. You are ultimately, it comes down to you taking a proactive approach to your health and finding those people that can get you through tough times and also maximize your health. So when something comes along like this, you're preconditioned for your body to have better results and less outcomes that are unfavorable for your health. So let's talk about what's going on around here. One is the concern of children. Do we go back to schools? Do we not? There's difficulty here because we need socialization with our children. It also frees up our kids. I know they don't want to go back to the school system. There is a concern because we just don't know yet of, what are the ramifications? Can a child pass this on to adults? And does it do anything specifically with children? Now, if you look at this reported finding, this is again from about 10 days ago. It looked at mortality rates when New York hit for children. It was 0.8 to 2.9%. So very, very low, but still something that we need to pay attention to, because 3% can be quite high, actually. Other states up to 9.1%. And again, what we currently have is 61,000 reported cases of children having this, and a small group of them needing hospitalizations as well. So it is a concerning finding. We don't really know the long-term ramifications of this, but I think personally it's ridiculous to think that if we send our children back, they're not going to be able to spread it to the adults who may be getting hit harder. Totally agree that as a child, it may not be hitting them as hard as an adult. My concern, however, is when they bring it back home, just like everything else, colds, which this is a coronavirus, and flus, it usually then circles around to the adults. And most of you know this because you've seen this every year. I think there are some awesome strategies that are going on right now. Some groups are doing smaller pod groups, so there's still interactions going on with children. They're not missing out on that. Another thing I saw the other day, and I think it's a brilliant idea, because in my opinion, two groups right now are grossly underappreciated in the economics. One is teachers. We screw them over, and then we pay their admin much higher, which really needs to change. That's one of my views, at least, is the schools are hurting for money, yet where's all that money going? It's going to pay the admin people, not the actual teachers, which is where my argument always stands. Same thing goes with physicians, and this is the same thing. Insurance screws people, and then the admin screws people. So I think right now might be a prime condition to say, okay, well, teachers don't want to go back because there's a higher risk, right? So what else could be done? Well, what could be done is some of these teachers could potentially work with families who want to do some type of homeschooling or schooling in smaller group sessions. And the teachers could literally have pods, and you can have a few different teachers involved in this exercise outside of the schools, and then they would charge per week based on the group. It would drastically increase the pay of the teacher. They would get actually what they needed now, and it would start to shift the method of schooling to a way of thinking a lot smarter and better for public education. So I think that's somebody's on to something there. I think that's a great idea to consider taking into consideration moving forward. Now, what else is also concerning? Well, there's a lot of positive tests going around, and how much of these are true? Well, there is an article that published a couple days ago now. So the CDC coronavirus test kits generate up to a 30% false positive. That's bad, right? Because that means you're testing a person and you're getting a false positive when they don't actually have it. And they're saying they're diagnosing you based on tests, and they're saying, yeah, you have it, but the test is entirely wrong. So that inflates the numbers. Now, what about the other side of this story? Because anytime we do testings, there's false positives and there's false negatives. So there's a 20% chance of false negatives. Now, this is really concerning, because then that means that the people that actually do have an infection are being missed and said they're clear, and then they're going out into work or public or around people, and then they're constantly spreading this. So the current screening test kits are not amazingly great right now. There are some problems with those that need to be fixed, and I'm surprised. When we had this cluster boom in New York, I'm surprised. We had several months, we locked down, we told people, let's give time for PPE and to get our crap together, that this wasn't done. So we've done a very piss poor job, in my opinion, of preparing for something that we knew would come back. And it's sickening to see this, because in the past, when we've had big things like wars or pandemics, kind of come together, and unfortunately what I'm feeling like is our nation is a bunch of sissies arguing babies, and we are not unifying very well, and it's very disheartening for this country, and the beliefs that I have in this country currently with that model, that we can't come together in one voice. How about that vaccine that they keep pushing and giving you hopes for? Well, here's a concern, and I share this paper again a couple days ago, was posted. What we do know is the coronavirus antibodies are fading fast. So meaning most people that are being tested again 2 to 3 months later, and I've reported on this before, are currently having very low to no antibody response, similar to what you see with cold, which is not that far-fetched because it is within the cold family of viruses. So that makes it incredibly difficult to make a vaccine that you can then give somebody and say, well, you're good to go, right? So that's disturbing. We also know that there's a few different strains, which I talked about this at the very beginning, and only seen a few news stations start to talk about this. There's one strain that mutated in Europe, rampaged in Europe, made its way to New York, and now that's the one that's really infectious, that's moving around down south. That first strain we had, strain A, came right out of China, went to the West Coast, Washington, California. It wasn't as bad. It still wasn't great, but it wasn't as infectious, so you can control it a lot easier. We're not talking about that. Why is that important? Well, we don't know if those two strains is also a reason why one person gets an infection and 2 to 3 months later they got another infection. Maybe it's two different strains that the body is having to deal with, just like we see with colds and flus. Or is this really that the antibody level has fallen so low that you cannot mount a memory response to this? So take a read through this article that I'm going to share with you, but it is definitely a concerning finding. Now, an interesting thing that we are finding, why is it kind of running people over and killing some people versus other people, it's barely touching, but they may still have some long-term side effects if we image them, look at them. It's possible. Well, we reported on some of those pre-existing conditions, lack of antioxidants, but the other one that came up, this was very interesting, this was published in Nature on the 15th of July, is that there's specific T cell immunity that may be really important, memory T cell, that may be really important in combating this so it doesn't blow up. An interesting thing that they were reading about, and pretty much what it said, is if you had these T cells that showed recognition of protein fragments to the common cold of human coronaviruses, that this could, in fact, increase your overall outcomes. So you're less likely to have one of those cluster booms, I'm in the hospital, and potentially mortality rate. Now, this does make some sense because it is in that coronavirus family. So again, there is some cross-reactivity, where if I had a person that gets maybe the cold, say anywhere between 1 and 3 times a year, their immune system's constantly being challenged by that cold and being exercised by that cold, versus the person that comes into our office. This is one thing that I've talked to people, that they say, I haven't been sick with anything, nothing, not even a scratchy throat or inflamed lymph nodes or fatigue or anything in 3 to 5 years. That to me is very concerning, because that means their immune system is not engaging. And the things that pop into my mind is, if this doesn't change, you're going to have cancer in the next 5 to 10 years, or you're going to have something really, really bad happen to you. So, and the reason that would happen is their immune system's not engaging because they're often so toxic or so sick that that doesn't happen. So when you do engage that, they start to be able to get healthy reactions. And healthy reaction meaning you're not getting sick, 10 times a year, but also when you get something that's not laying you out for several weeks, it's more like your typical course of 5 up to 10 days of you just don't feel great, but then you get over it. So that is very interesting. And that may be a case that, hey, getting these cold infections intermittently may actually give some protective value for you because of T cell immunity. We'll see how that pans out, but that is really cool. It may explain why some people get laid out, other people don't get laid out. Another factor. Now, what else can we use therapeutically? And I talked about this, but it's nice to see another paper discussing this further. Thymus Alpha One. Talked about this as a peptide. This paper talks about its reduction of mortality in severe COVID-19 by restoring those lymphocytes, mainly increasing the white blood cells, and also exhausted T cells, or these are the T cells again that fight things, just like we talked about with the common cold. So you could potentially keep your body stimulated by giving yourself this Thymus Alpha One, which we use in the clinic. I use it personally. I love the product. No side effects. It's super awesome. If you've never heard of it, again, talk to one of your doctors or schedule an appointment with one of our doctors and we can discuss it. But it's super awesome. If this Nature paper is true, this would definitely play a higher role in priming people or preconditioning proactive health for people as you're moving forward, especially if we're not able to achieve a vaccine because of what we're seeing, or an effective vaccine. We have to look at other methods besides spending billions of dollars in vaccine research. Another one that came out, I'm going to follow this. It's a new thing that I just saw. Came out July 15th also. Basically talked about a cholesterol lowering med. It binds fats in the bile system, and it could potentially downgrade the severity of this to more like a common cold level. Now, how is it doing that? What is their theory for that? Well, what happens is what they're looking at is this virus tends to have a large amount of fat accumulation in the lung tissue and other tissues, and it needs that in order to replicate very well. So it makes it so you don't metabolize fat in your tissue like you should, is how this infection is working in one of their theories. So in their theory is you give this drug, and what this drug would do is it would help improve the metabolism of that fat, so it's not stored and it is actually metabolized. So then it doesn't turn into this severe case where you have multiple replication of virus. Again, I do believe if this is true, the best case would be to give this early in session versus late. So we'll see how that pans out. That was brand new, but it's very interesting to me. Now, another thing that does keep hitting the news, and you really, this is huge for your proactive health tip, and it goes across with any chronic disease. This is not just coronavirus or COVID-19, but abnormally high fasting blood sugars. That's meaning a 10-hour, I didn't eat anything, I just had water, I did my blood sugar in the morning. If you were having higher fasting blood glucose, your mortality risk doubled if you got COVID-19. And that's not just with COVID-19, that's with everything. That's increased chances of cancer, heart attack, strokes, increased overall mortality, increased aging processes. So this is nothing new, but it kind of beats the point home that you really need to take control of what you're putting in your body and stop treating your body like it's a garbage dump, right? Put clean fuels in there. You do not want to push those sugars very high, because that is a massive risk factor. The final paper is just a revisiting, but it does talk about looking at quercetin, which we talked about in previous videos. Quercetin, remember, is a zinc ionophore, and it also is a great bioflavonoid, and vitamin C in prevention and the treatment of this disease, making this disease less booming. And so there's another paper on this, and it's really not too high of a dosage, but it was published in an immunology journal. And what I want you to illustrate, and I've been doing this in all these videos, is really there are so much other things that we can be focusing our attention on. And there's this huge thing in the US right now still that we are kind of ignoring the cheap and the easy interventions and the proactive things, just like we've done in medicine for years for heart disease and cancer, and proactive approaches to prevent those, just like we do in our practice every single day with patients, because we know there's a high risk of those developing in the lifespan. The whole campaign needs to be around proactive medicine. The whole campaign needs to be looking at some of these very, low-level, cheap interventions versus pissing our time away and spending billions of dollars on expensive drugs and expensive vaccine that may or may not work. And we really need to have an answer before we invest that much money. I'm not saying don't invest anything in that, but we need to balance our research a little bit better and allocate our funds appropriately, so we're not putting everything in one bank. And the reason we put everything in one bank is, show me the money, show me that incentive, and then I'm going to invest everything. And it's really sad the way medicine has become, but we've also done that with education as well. So hope you guys like this. Please share it. Hit the like button if it's on the YouTube channel or even on Facebook here. Please do share this to somebody else. I get a lot of comments, a lot of people asking me, hey, talk about this. What do you think about this? So please get this word out. That's the best gift you can give me. You have a great day.